I'm going to go off my script for just a moment and say, I buy car insurance in case I get in an accident. I might not know 100% certainty how many degrees the Earth will warm under climate change, but I'm willing to pay something to decrease the probability of that warning, to decrease the probability that more kids will end up in the hospital for emergency treatment for asthma. I'd be willing to pay that money to decrease the probability that my daughter doesn't know about polar bears when she's 60 or when she has grandchildren. And that was my statement about insurance. We pay it to decrease the probability of extreme outcomes. And by the way, you never buy insurance up to the value of your car. It's the value that you expect if you have an accident. So it's the expected value of that car. I just saw my 4-year-old in my eyes when he made that comment, and that's why I lost my temper, so I apologize. Okay, so back to my prepared statements. I want to thank the Union of Concerned Scientists for an incredibly detailed and convincing report, and very informative report. Go ahead. The fact that these impacts in 1 year, by 2020, my child will be 16 years old, is on the order of $5.5 billion, to me, is convincing evidence and compelling evidence that society needs to act to curtail carbon emissions. The economic take-home message is that if we fail to act, American families, we will all be facing increased costs because of increased respiratory illness, lost work days, school absences, and lost productivity. These costs have real implications for American families, especially those who have family members with asthma or chronic lung disease. The increase in premature deaths has real consequences for our economy as a whole, because it represents a loss of productive resources and a real drag on our economy. Reading these statistics in the report might seem overwhelming, but I want to come back to the information that Dr. Dockery presented, and we should really feel reassured by this. By 2020, we will receive approximately $2 trillion in that year alone in the benefits from the Clean Air Act. And how much did we spend to get those benefits? We'll spend about $65 billion. So that's an order of almost $37 in benefits for every dollar spent. That's an incredible return on an investment. I mean, we just don't see that in the economics or finance literature. And we know that the EPA has the mechanisms to create these incredible benefits. Our responsibility as citizens and as scientists is to ensure that we maintain the integrity of the EPA so that it continue to do its job to support and protect American families. So modeling these effects is a very complicated process, and the approach that the Union of Concerned Scientists took was cautious at each step. It's very complicated to do this kind of modeling, and I think that's part of why I was invited to talk about this. And so what I want everyone to go away with this, from this meeting understanding, is that the future costs are on the order of $5.5 billion, but there are additional costs that aren't captured here. And let me first explain the effects that aren't captured in this report, or the additional costs that we're going to have. First of all, there are likely to be hot spots that are going to have greater effects than the national average. For example, there's regional variation in the prevalence of asthma. So nationally, it's about 13% of kids who have asthma. That's a big number. But many schools in Springfield, Massachusetts, where I live, have asthma rates as high as 20%. And believe it or not, there are elementary schools that have asthma rates of 40%. So if you can just imagine what it's like to be a teacher in those classrooms, you start to get a sense of the scope of the problem. So these communities that already have high prevalence of asthma are going to have even greater effects than the national averages due to this climate penalty. The second factor is that the frequency and severity of asthma episodes are highest in low-income, non-white urban populations. These excess burdens are due to a lot of very complicated factors, but what it means is that for the same increase in ozone, those communities are going to have even greater increase in effects than the national average. And the third factor is that climate warming is going to lead to both greater density as well as a greater distribution of allergens. Now, for many of us, allergens are bothersome, and maybe we take our Claritin in the morning. But for kids with asthma, these can be very important triggers. The Union of Concerned Scientists used the EPA's model to estimate the cost of these health effects. So there are going to be greater health effects in some regions in the country, but also there are going to be some additional costs to these health effects. There are likely to be other costs that are similar to this in the report that aren't captured in the report, but I'm going to speak to the cost of asthma directly because that's my area of research. So let's just think about the report's finding that in 2020 there will be an additional 950,000 days of school that will be lost because of kids who are homesick with asthma. That's almost 1 million days. I mean, that's an incredible number of school absences for 1 year by 2020. Now, the EPA models the cost of those school absences as the wages lost for the proportion of parents that are employed outside the home. And this approach doesn't include some important costs. First of all, by including the wages only of the proportion of parents employed outside the home, the time of the parents who are not employed outside the home is valued at 0. And this is really problematic because the time of those caregivers, the time of those parents is valuable both to the household and to the society as a whole. Second, this approach does not incorporate how asthma affects employment in families. In my research, I found that 18% of families had a parent who had been fired or had to quit because of needing to take care of their child with asthma. So these parents would have been working if their child wasn't sick with asthma. Further exacerbating the problem is that these changes in jobs have implications for their lifelong earnings. So not only are the days that they're home taking care of the kid when they're sick with asthma being valued at 0 by the EPA, it is going to have a lifelong depression in the amount of earnings that they can expect to have. And as those of us with children know, staying home with a sick kid is not a vacation. And as a 4-year-old with a mother of a 4-year-old with asthma, I can assure you that I would much rather be working than staying home when Willow has a bad asthma day. In addition to my lost wages, there's the pain and stress of watching her gasp for breath. And quite honestly, I would rather pay to go to work than have to stay home to take care of her when she's sick with asthma. And finally, children are missing valuable instruction time on those asthma days. Studies suggest that days absent is negatively related to school performance and that children with frequent asthma symptoms tend to perform poorly compared to their peers. These will have lifelong implications for their earnings and their future performance. And what these costs really don't capture are the multiple ways in which these respiratory systems affect daily life. I actually started studying the economics of asthma long before I was a mother and long before I had a child who developed asthma. And I can say that on a good asthma day, what my daughter does is she gets up, she takes 2 puffs of her medication, she takes 2 antihistamines. In the evening, she takes 2 more puffs. And that's a good day because she gets to play and her activity isn't limited. On a bad day, she is hooked to a nebulizer, breathing in steamed air with medication. She doesn't feel like playing. She obviously doesn't go to school. And these episodes can last from 5 to 7 days. And I remember when I started doing this research, families were talking about all the ways in which they were affected. And I dutifully, as a nerdy little economist, was like writing down all these little things that I could attach dollar values to. And I don't think I really got it. When you have a child with asthma, that's when you really get the ways in which everything is affected. Whether or not you can go away for vacation, where you go for vacation, what friends' houses she can go to. And I'm never free. Every day, even if she has a good asthma day, what I'm thinking about is, when's the next bad asthma day going to be? So these are an incredible depression, it's just an incredible effect on every aspect of your life that these dollar values just really don't capture. So the last point that I want to make is that the climate penalty described in this report raises a serious environmental justice issue. The U.S. EPA defines environmental justice as the fair treatment and meaningful involvement of all people, regardless of race, sex, color, national origin, or income, with respect to the development, implementation, and enforcement of environmental laws, regulations, and policies. So we know that there are existing health disparities with respect to asthma, and climate change is going to exaggerate those disparities. Thus, the effects of ozone under climate change will be both costly for society as a whole and seriously jeopardizes the pursuit of environmental justice. In summary, this report is scientifically rigorous, and it shows that the costs of the climate penalty are substantial. A healthy economy needs healthy people, and the climate penalty thwarts this goal. The magnitude of the cost is so great that even if there are likely to be additional costs, the report calls on us to act now to reduce carbon emissions. We have the regulatory capacity in the EPA. We have the technology. That's the amazing thing. And past experience shows that when we set those standards to protect human health and the environment, actually businesses rise to that challenge. And we have actually economic growth, and the kind of economic growth we want. Not low-paid, unbenefited service jobs, but jobs in the technology sector, the kind that all the states want to have their people employed in. And what we really need, what we're lacking right now, is not the economics, not the technology, not the regulatory capacity. What we're lacking is the political will. Thanks.